I've had the chance to work with veterans and first responders. Actually, the most common connection between veterans and law enforcement are former veterans, or sorry, not former veterans, but veterans who have left the service and taken a civilian job with local law enforcement, and then get on a commercial health plan through the law enforcement agency, and then that's how I end up working with them. Likewise for firefighters and EMTs. I actually have a number of EMTs and firefighters in my practice because they're, at least in the local area, their commercial plans, or I participate in their commercial plans. So, so I've gotten to do some work, and which has been really a great experience for me so far. So, so what I want to do is just kind of give this will be a fairly high level overview because we're going to talk about military, veterans, and first responders in one lecture here. So it'll be kind of a high level overview of some behavioral health integration aspects. Certainly, when I was, again, this is also one is nice. Another nice thing about this is that this is not an area that we explored when I was a student, and I don't think really any, or unless a program was specifically geared towards that end, and I find this to be true with most disciplines, that there wasn't any kind of consideration given to the nuances of clinical work with military veterans or first responders. So, so I'm glad we have the opportunity to do that. So, in terms of the military, what I want to do is kind of walk you through what the Navy and the Army offer in terms of not just behavioral health, but also kind of more broader social work, social services, and social work type of support for Army and Navy personnel. And it's not to deliberately ignore the other branches, but rather just when I went and prepared, when I've done research for this lecture, I did some initial research a number of years ago. First time I started putting this together, and then try to go in and update it. I found that at least in terms of going into the .mil and .gov sites, that these were the two branches that at least identified the most extensive behavioral health support. It's not to infer that the other ones don't, but I wanted to, whatever information I could find, I wanted to try to pull together for you here.